Back in March, when this pandemic first hit, I think we were all very affected by the growing numbers of deaths internationally. There was a desire as biologists to see if we could be part of the solution.
Since the beginning of the pandemic, it was clear to us that housing, water, and sanitation were essential.
COVID made us realize that, there was a significant challenge for any kind of critical care.
For the Philadelphia region and really across the country, we saw a 60% increase in people who are food insecure.
I'm virtually running a COVID center at home. 9 of my family members were positive.
The first patient of COVID came in on 26th of February, and 27th of February, I was at the Chief Minister's house. And then I'm part of the COVID task force.
When the pandemic hit, we moved quickly to implement measures that prohibited eviction. We gave financial relief for housing loans. In May 2020, we announced 200,000 housing subsidies for the purchase of new homes. This is the most ambitious program in our history.
What we are able to do is screen many drugs using robotic platforms that allow us to look at many little models and then screen 3,000 or 5,000 compounds against those organs using this platform. We hope to be able to find drugs that will protect the most severely affected cases and prevent death. And that's a key addition to the arsenal that is going to be needed to treat COVID-19.
Instead of our original 2-year plan to launch telemedicine, we trained 5,000 clinicians in 4 weeks. In 2019, pre-COVID, we performed 7,000 video visits. Post-COVID in 2020, we performed 1.1 million.
In Rwanda, we provide medical consultations over the mobile phone. We do over 5,000 consultations every single day. Across all the districts in Rwanda, we entered into a partnership with the government of Rwanda to take care of people who are asymptomatic or mildly symptomatic and do have COVID, so that they don't need to go and clog the healthcare system.
We have about now 13 hospitals across Pakistan. We have public health and primary health programs in 51 districts of Pakistan. We have 4 lethal blood centers. We have 4 physical rehabilitation centers. Our first year budget was $1 million a year, operational budget. Now it is $220 million a year.
It sort of made my fellowship, project almost seem prophetic, because suddenly people started coming back to me and saying, well, that critical care unit that you were talking about, how can we do it?
The fellowship program has had one of the biggest impacts on my life. I think without the fellowship, I would have never been open to what I'm doing today.
While coming to US during my fellowship, it opened doors to me. Initially, I was a shy man, so very introvert, but with Eisenhower Fellowship, I am outward now. I can speak at any forum.
My Eisenhower Fellowship experience has been as rich post that travel as it was during that travel. And so I have been able to connect with, access, and be inspired by Eisenhower Fellows from around the world.
As Eisenhower Fellows, we embrace the responsibility to respond and serve. Thank you to EF for the true gift of fellowship, to give us the strength and inspiration to solve the problems that are not yet solved, and to make the world more peaceful, prosperous, just, and healthy.